One of those people who've been on the fence about taking a vacation on a cruise ship, the government's latest action might have you changing your mind. Just as the cruise ship industry appeared to be rebounding from the worst of the pandemic, the CDC is now warning the public not to set sail. Debbie Sanchez and her family returned home from their cruise out of Miami just 24 hours earlier. But it was that final day of her vacation she won't soon forget.
My first thought was that it was a bummer. I was scared, a little scared, that my son was positive, but he's had COVID before.
She found out her 11-year-old son Christian was exposed while on board, leading the ship's medical team to run a PCR test that came back positive.
How am I going to be in this cabin with an autistic 11-year-old who wanted to be out? This was not going to be a fun experience.
For Debbie and her son, they spent the last day of their cruise in quarantine. CDC says the spread of COVID on ships has become enough of a concern. It's raised its risk to its highest level, red, while telling people to avoid traveling on cruise ships regardless of their vaccination status.
There have been very few cases of COVID on cruise ships. When you look at percentages, it's less than 3%. So for the CDC to do this is definitely an overreach.
Scott Laura is a cruise ship industry expert. He's with thecruisegenius.com. He believes the CDC's actions have been unfair.
The fact of the matter is hundreds of thousands of people have already cruised. They've cruised safely, and they've been having a lot of fun doing it.
He recommends people take that cruise, follow the rules, and buy travel insurance. As for Debbie, she says the cruise line did everything it could to make them comfortable, even reimbursing them for the final day that they lost while in quarantine.
Would I go on a cruise right now? Probably not, especially after this experience. I don't want to poo-poo the cruise industry. They really are doing everything possible.
You'll remember at the height of the pandemic, the CDC stopped cruises from setting sail. When it did allow them to start back up this summer, it came with some very tough restrictions. Those rules were expected to be optional heading into the early part of this new year. But with the rise of COVID variants, the CDC appears to be heading in the other direction now.
Tonight, some travelers are second-guessing their plans, and travel agents are scrambling after the CDC warned people against going on cruise ships. CBS 12's Danielle DeRoss tells us how one of Florida's biggest industries is handling this latest setback.
After being docked for most of the pandemic, cruise ships like this one just started sailing again this summer. Now the Omicron variant and the CDC's latest warnings are posing new challenges for an industry struggling to get back on its feet.
I'm not understanding why the CDC did this.
Travel agent Leslie Tillum is fielding a flurry of phone calls from clients concerned the CDC has now recommended against going on cruises, even if you're vaccinated.
I have had a few people call me concerned. They're debating it, and I have a feeling I'll get more cancellations. I have had a few. My team has had a few. It's very disconcerting.
The CDC issued a code red alert yesterday, its highest level warning due to the number of new COVID cases on board cruises. Right now, the agency is investigating potential outbreaks on more than 90 ships. In a strongly worded response today, the Cruise Lines International Association took issue with the CDC's guidance, saying in part that it is, quote, particularly perplexing considering that cases identified on cruise ships consistently make up a very slim minority of the total population on board, far fewer than on land, and the majority of those cases are asymptomatic or mild in nature. They add cruise lines go above and beyond with masks, tests, and vaccination rules, except for ships in Florida, where vaccine requirements are against the law. Still, for some would-be cruisers, it feels too risky.
You don't want to put your family in that predicament if you don't have to.
Kelly Fry and her family booked a cruise back in 2019. They've been trying to rebook ever since, and now with all of this going on, she just wants her money back.
And we thought, oh, we'll be fine, by 2 years into this, and no.
None of the cruise lines that we reached out to responded to the controversy, but we did hear back from the Port of Palm Beach, which tells us they're monitoring the situation and working with their tenant, Margaritaville Cruise Lines, to be in CDC compliance.
COVID cases are surging across Florida as the lines at testing sites grow longer. Officials are now scrambling to respond.
Opponents blame Governor Ron DeSantis of being absent as the Omicron variant burns through the state. CBS 12's Jay O'Brien joins us with that story and the numbers behind the surge. Jay?
Yeah, guys, there's no question Florida is having a hard time with this surge. We're going to look at the Sunshine State compared with some other places. This graph comes from the CDC, and we had it narrowed down to California, New York, New Jersey, and Florida. If you wanted to look at Washington, D.C. or New York City, they're off the charts here. The COVID infection rate there is huge. But if you look at states, this line right up here at the top, that's New Jersey. Second on this list is Florida, right? New York is behind Florida in terms of infection rate. California is all the way down here. In this surge in cases, it's not just numbers. We're seeing it play out across the state on the ground in Florida as overwhelmed local officials are pleading with Governor DeSantis to step in. To see the Omicron surge firsthand, look for a line of cars. Testing centers jammed every day this week, some in Palm Beach County closing early today, running out of supplies, facing a crushing demand.
And they just closed it there. I mean, it was full.
Every single testing site statewide is run by local officials or private companies.
Local governments have been left to figure it out.
Orange County Mayor Jerry Demings slamming Governor Ron DeSantis for not doing more.
Where is Ron DeSantis now?
His comments igniting a firestorm. Other Democrats asking where the governor has been as the state weathers the Omicron surge. DeSantis' last public event was before the holidays. The governor's press secretary responding, tweeting the governor has a right to spend time with his family, but did have a meeting today with the state surgeon general and will be back to a full public schedule on Monday. Meanwhile, the Omicron spread is unprecedented, far outpacing the Delta variant that wreaked havoc over the summer.
How rapid of a spread has this been?
Extremely rapid.
Jason Salemi is an epidemiologist with the University of South Florida.
Where this surge heads has to do with the actions that we take.
Those actions include getting the third booster shot, which health officials say is necessary to protect against Omicron. But in Florida, booster rates are low. Only 33% of vaccinated adults in the state have gotten the third shot. In nursing homes full of vulnerable residents, less than half have been boosted, according to the CDC. Now, hospitalizations in the state are pretty stable. ICU usage is 77%. This is the Department of Health and Human Services. Only about 7% of ICU beds, hospital beds, are being used by COVID patients. It's a little too early to tell, particularly with how fast cases are climbing. But the experts that we are speaking with say that the early signs show that hospitalizations will stay low potentially, even as cases may rise.